we're going to end on some more cheery notes. Isn't there a simpler way to cover the uninsured and cut costs other than bankrupting our country, rationing boards, and destroying the doctor-patient relationship? There are alternatives out there, contrary to what the general media would have you believe, and they're great. We're going to go through a couple of these right now. First off, I want to briefly mention there are a few doctors groups out there. There's Docs for Patient Care, there's Doc Squads, there's DPMA, or Doctor Patient Medical Association, there's the American Academy of Physicians and Surgeons. There are multiple groups out there, all with similar but good ideas for true healthcare reform, because our country, we absolutely need it. So briefly, we're going to discuss two. There's Paul Brown. This is his bill. I can hold it up because it's not 2,604 pages. It's only 51. You can download it easily on his website, and it's called the Option Act. There's a second one, and this is even shorter, 17 pages. Representative Tom Price in Georgia, his plan called the Empowering Patients First Act. Now, I don't know what it is about Georgia, but both of these bills come from congressmen in Georgia who happen to be physicians. So I think there's something going on down in Georgia. First, we're going to discuss the Option Act, Paul Brown's Act. How does he propose to cover the uninsured? By 159 new boards, agencies, by a tax? He proposes covering the uninsured by charity care credit. So, if I'm a private physician and a patient comes in without health care insurance and needs to have care, I take care of that patient, and then that's written off of the business's taxes. That's a pretty simple way to try to bend the cost curve down and cover some of these patients. How does Paul Brown propose to cut costs? Number one, repealing the floor on medical expense deductions. Currently, you have to have, might be 7.5% of your gross income. If your medical expenses exceed that, you can write them off. If it's below that, you can't. And they're raising that ceiling to 10% so they can get more money for this project, PPACA. So Paul Brown proposes repealing the floor, expanding the use of HSAs, which we'll touch upon in a couple of slides. That will help drive down medical costs, and also to allow insurance to be sold across state lines, just like, say, car insurance. Increased competition, increased market forces, that will drive down costs. He also, like Paul Ryan, proposes increasing choice when it comes to Medicare and creating a Medicare Premium Assistance Program, where basically you have your allotment for Medicare, and you can either slide into Medicare or use that for a private plan. Tom Price, how does he propose to cover the un- and underinsured? By tax credits for health insurance for low-income individuals. So you're given a tax credit, they can go out and purchase insurance. And also state-run high-risk pools. Currently, 35 states have high-risk pools, and Tom Price's bill would increase these and help with these patients who need to have health insurance but have a pre-existing condition get insurance. Now, how to cut costs? In Tom Price's bill, allow insurers again to sell across state lines. You see a common theme between Paul Brown and Tom Price's bills. Medical liability reform, which Paul Brown's bill does not have in it, and Tom Price's does. We'll touch upon that in a few slides. And the last two bullets really kind of belong together. Small business fairness and individual membership associations. What both of these agencies or groups do is, if you're in a small business, you can get together with the other trades, other plumbers or what have you, pool together and use your resources together to buy insurance. And in a perfect world, that can be across state lines. It also allows individuals to do the same thing. Tom Price's bill increases choice by creating an equal employer contribution rule. What that is if you go to work for a company and they provide insurance, they could also provide you that same amount that they would use to purchase your insurance so that you could go out and buy your own policy. That way, your policy would stay with you wherever you go. Think about what that would do to pre-existing conditions as well. Tom Price also advocates improving beneficiary choices for Medicaid and CHIP, similar to what Paul Brown and Paul Ryan both have put out there. So, 3 R's of sustainable reform: medical liability reform, insurance reform, and personal responsibility. First, we'll touch upon medical liability reform. After one of my talks, a tax attorney came up to me and said, you know, the United States has 4% of the world's population, but 94% of the world's lawsuits. I said, you know, that's too bad to be true. You've heard things are too good to be true. I thought, this is too bad to be true. So I researched it, and he was wrong. He was wrong. The United States has 5%, not 4%, 5% of the world's population and 94% of the world's lawsuits. There is something wrong with that. Now you'll see in this slide, there's a picture of me and a man that's not my husband, okay? That man is my brother, the OBGYN in South Carolina. And I put this slide up here, that picture, to remind me to tell a story. When I was visiting my mom, and my mom lives in the same city as my brother in South Carolina in April, he came back from his practice meeting. And in his practice meeting, their malpractice carrier had come to them and said, you know, we might have to drop coverage of your practice. And their practice has not lost a single lawsuit. Now, the reason that this medical liability insurance carrier might have to drop my brother's practice is because there are so many lawsuits that are brought up against this OBGYN practice. And the cost of defending each one is approximately $500,000. So this practice is doing nothing wrong except for being around a bunch of lawyers. And yet, their carrier might drop them because they can't afford them. They don't know what they're going to do yet. They don't know if they're going to have to limit the patients that they see, they're going to have to leave the county, or if they're just going to have to disband. They still haven't decided. So the cost of defensive medicine. Approximately 90% of doctors perform defensive medicine. Now, this is in a study. And I would say the other 10% don't realize that they're doing it. Physicians attribute 34% of overall healthcare costs, to defensive medicine, whether that's ordering an MRI or ordering some additional blood work that's just not necessary. 34% of healthcare costs. There's been one study that shows that defensive medicine costs the United States $150 to $200 billion per year and can add up to $1,700 to a family policy. Okay, think of what we could do with $1,700. I could do a lot with it. Medical liability reform needs to incorporate medical specialty courts, not bureaucrats, that determine the merit of a case, and the judgment should be calculated by an expert panel. There should be caps placed on non-economic damages, and something that would really help is a loser pay system. So if a patient has come up to me and says, you know, Dr. Triepel, I have a lawyer and I'm going to sue you because my thumb is not good. I know I came in with an infection. I know I came in with a dislocation along with that infection, but I'm going to sue you because my thumb's not right. And we go to court, and the panel sees that as soon as that patient was seen by me, I admit them to the hospital. I have infectious disease consult on them. I have internal medicine consult on them. I operate them on a right away, and see that everything was done according to the standard of care. And he loses his lawyer's pay. I've had a type of event occur such as that. That would cut frivolous lawsuits. In Tom Price's bill, He proposes limiting non-economic caps to $250,000. And Texas does that currently. He also proposes limiting lawyer fees, because at the current time, within Virginia, a malpractice lawyer will take 40% of a judgment, 40%. And establish healthcare tribunals to help determine the merit of a case before a case would go forward. So again, just some examples of current malpractice. In Virginia right now, we have a $2 million aggregate cap, so for economic and non-economic damages. And this was a recent agreement between the Medical Society of Virginia and the Virginia Trial Lawyers Association. It was thought to be this great big win. And it increases $50,000 per year up to year 2032. You can contrast that with Texas, where there's a $250,000 non-economic cap. And then the states are all across the board.